Dermatology Part 3, erythema nodosa, painful nodules, quite common actually. Paniculitis, tender, painful subcutaneous nodules, particularly on the shins. Don't miss this one. Underlying cause, you can see here, strep, sarcoidosis, TB, resolves spontaneously. Granuloma annulari, dramatic little red nodules, nothing serious. Paniculitis, fat, inflammation, fat people. Pyoderma gangrenosum, chronic progressive skin necrosis, unknown, often systemic. The Stevens-Johnson syndrome often comes up in exams. Two types, where it involves less than 10% body surface, and then toxic epidermal necrolysis, where it involves 30%. So many patients die severe cutaneous hypersensitive reactions, drugs, sulfur drugs, antibiotics. Macules rapidly spread, cold, less dramatic, clinical diagnosis, supportive care, steroids. In other words, it's a pretty serious condition, got to get the physicians involved. Mortality can reach 40%. Onychomycosis, fungal infection, nail plate, nail bed, rather dramatic here. Paronychia, painful big toe infection, periungual tissues. Local treatment, mainly partial excision of the nail plate and bed, and good care to the toenails in terms of cutting to prevent it. Parasitic skin infection, cutaneous larvae, migrans, dog or cat hookworm, dramatic hookworm infection, cutaneous myiasis. Delusional parasitosis, well, good for psychiatrists, but probably don't believe it. People think they're infected with parasites. Lice pediculosis, again, another example where mothers get very worried. Children have lice in their hair, the hairy parts of the body. Nothing serious, easily cured, close contact, maybe sexual. Scabies, another one of those, dramatic presentation. Itching, scabies, you can observe it, burrows in the web spaces, everyone gets all upset. Diagnosed by warm and scraping, nothing serious, easily treated. Pigmentation disorders, albinism, can be quite serious. Occutaneous albinism inherited, defect in melanin production due to this deficiency of tyrosinase activity, that enzyme. Hyperpigmentation, maybe total or partial. Eye involved is pretty important actually, so they'll be involved the eye surgeon. Ophthalmologist, diagnose obvious eye skin, do an eye exam and put treatment for the skin, except stay out of the sunlight. Nothing special, except stay out of the sunlight, check out the eyes. Vitiligo, up to 2% population lost skin melanocytes, cause depigmentation variable, cause unknown, diagnosed obvious, topical steroids and various other medications. Hyperpigmentation, focal or local, don't miss Addison's disease, or sometimes a drug cause, maybe post-inflammatory. Now, pressure areas, I want to mention these. Heel pressure areas, very important, especially after operations. Pressure areas over the heel, this can determine the outcome from the surgery. Do great surgery, get a pressure area because of poor post-op nursing care, and these can be very hard to fix. Take seriously, start heel care, that's on the sheepskin or special mattresses in the recovery room after surgery. The whole range of risk factors, old age, poor nursing care. Now, if it's a full thickness skin loss, you may need to get the plastic surgeon involved, but it's pretty hard to get them to heal actually. Now, psoriasis is another example of a scaly condition. Patients very stressed by it. Got lichen planus, recurrent pruritic inflammatory eruptions, small discrete, flat top, violaceous papules. Treatment, steroids, lichen sclerosis. Now, pityriasis lichenoides, you can read it there. Pityriasis rosea, read it there. Pityriasis rubra pilaris, read it there. Now, psoriasis, common, 1 to 5% of the world population. Inflammatory disease, see it around the point of the elbow, around the knees. Cause unknown, can be triggered by drugs, stress, and a small percentage of cases get a painful arthritis, not that many actually. Diagnosed clinical. Now, treatments, emollients, vitamin D analogues, retinoids, corticosteroids. Stressing for the patient, shed a lot, goes everywhere, needs good attention. Reactions to sunlight, Dracula. Photosensitivity, poorly understood cutaneous reactions, sunlight may be related from certain drugs, sensitize you. Treatment varies by type. Sunburn, common, sun-drenched areas of the world. Erythema, pain, blisters, swelling, treat symptomatic. Slip, slap, slop. The effects of sunlight. Well, you could write a good essay on the effects of sunlight, couldn't you? causes problems aging the skin, see it on X-ray therapy, as per X-ray therapy. Actinic keratosis, precancerous skin cancers. Sweating disorders, bronchidrosis, excessive abnormal body odor from too much sweating, bacterial infection of the sweat. Hyperhidrosis, excessive sweating, focal, local, obvious treatment, topical aluminium chloride, tap water. Hypohidrosis, miliaria, sweat flow obstructing trapped within skin. Viral skin conditions, molluscum contagiosum, common. Clusters of small, waxy, pearl-shaped. Good to make a diagnosis, nothing serious. Now, warts in children, quite common, aren't they, around the hands, can be sexual around the genital areas. The genital associated cervical cancer, great worry to the patients, and actually can be quite hard to treat. Diagnosed obvious, treatment self-limited, excision, cautery, cryotherapy, liquid nitrogen, topical, injected steroids. Hard to treat, various treatments available. Okay, I hope you find that useful. Look out for the following modules and other areas of clinical medicine.